My name is Cardinale Smith. I am a doctor at Mount Sinai Hospital, and specifically I am a palliative medicine specialist. So I'm not sure how many of you are familiar with palliative care. Have you ever heard of it? Yes? Okay. So palliative care is really a special type of medical care for patients and their loved ones living with serious illness. It really aims to help relieve the stress and symptoms like pain, shortness of breath, and other suffering one might be feeling when dealing with a serious illness like heart failure or cancer or dementia or many, many others. One of the really great ways to think about it is that it's an added layer of support on top of the routine medical care that you're getting for the illness that you have. Palliative care is provided by a team of specialists. These include physicians, nurses, chaplains, social workers, and many others, depending on where you're able to receive the care, like art therapy or even massage therapy. Anybody want to say? Okay. Palliative care is often, you can receive it like any other type of medical care. So you need a referral from your primary physician to get it. It's covered by insurance, just like seeing your primary care physician is covered by insurance. And it's something you often have to ask about. It's not something that is typically routinely offered.
It is associated in some people's mind with just elderly people, but evidently it's not. It's for all people.
Yeah, so palliative care is appropriate at any age, even if you're a young child who's dealing with a serious illness, out to the older adults. And it is appropriate for any stage of illness, whether you're receiving curative intent treatment or if the intent of your treatment is really for prolongation of your life or to improve quality of life.
How long has this palliative care been available and to what institutions?
Yes.
If you don't know about it.
Yes, so the question is, how long has palliative care been available, and essentially, where can you get it? So palliative care is a specialty that has been around for almost 20 years now, maybe a little bit longer, but it has taken a while for everyone to get to know about it and to be able to ask for it. It is available at most institutions. All you have to do is ask the primary care doctor taking care of you for a referral. And if you need to find out where it might be near you, there are some websites in the program, but getpalliativecare.org is a really great reference for you to find someone local to you.
Is it only for physical illness or also emotional, mental, psychological illness?
So I think palliative care helps with not only physical suffering from illness, but also the emotional suffering from illness, and so is appropriate really for any illness.
Is there a trend for doctors to be trained in offering this? Because if you don't know to ask, then you don't know.
It's part of the reason why I'm so excited to be able to be here to talk to you all, because it isn't something that is well known. Like if you have a heart problem, you know to ask for a cardiologist or a heart doctor, but if you have a serious illness and need extra support, you don't know to ask for a palliative care physician. And so it's part of being here speaking to all of you and having you speak to those in your networks to get the word out so that other people know it exists. And it's particularly important in minority communities. Minorities often suffer from higher stage of illness and higher burden of illness, even when all things being equal, and palliative care can really help with that and help relieve the stress and suffering.
What is the difference between palliative care and hospice care?
Yeah. That's also a good question. Palliative care and hospice care are also considered to be interchangeable. That's not true. I think of palliative care as the big umbrella under which hospice care is one component when you are towards the end of your life. But palliative care is appropriate throughout the trajectory of your illness, whether you have an early stage or you have a late stage. And with palliative care, you can still receive regular standard care for your illness, unlike hospice care, which essentially says you have about 6 months or less to live, and your focus is really on quality of life and not treatments directed towards your primary disease.
My question is, how does this work for, or if it does, for caregivers
Yeah.
of the people with dementia, Alzheimer's? Because I work for a family who has, the mother-in-law has dementia, and the father-in-law has Alzheimer's. And so I'm stuck.
Yeah, being a caregiver is certainly not easy. I've been one myself. The palliative care focuses not only on the patient, but also their loved ones. And I use loved ones broadly because that means many different things depending on your family type. Palliative care really understands that you function as a unit and that if your loved ones aren't there and aren't taken care of in all the ways they need to be, whether that's physical, spiritually, or emotional, that then they can't take care of you. So palliative care focuses on the caregiver and the patient as one. So the question is this available around the country? The answer is yes, this is available around the country. Greater than 90% of all large hospitals have this. It is a challenge in some of the more rural settings, and we've begun to develop really innovative ways through telehealth. So imagine FaceTiming or Skyping your physician or nurse to talk about the things that are bothering you and make a plan of care that way. So there are lots more models being developed to reach everyone who developed